Zoo Vet Comparative Medicine, CPR edition. Have you ever considered what it would take to resuscitate a bird versus a tortoise versus a fish? And don't laugh, I have done CPR on fish, I've done CPR on all of those things and many, many more, but you have to take into consideration your patient's unique anatomy and physiology. Our biggest obstacle in CPR for birds is something called the keel. Most birds don't have ribs, they have a keel, which is like a big solid bony plate where your sternum is located. So that is a major hindrance when it comes to trying to compress the heart, because there is a solid, you can think of it as like armor, chest armor, directly over the heart. Despite the fact that that absolutely does hinder our ability to actually compress the heart and circulate blood, we generally do still perform chest compressions because it's our best option. How much force you're going to use and how fast your rate is going to be. All of that is going to depend on the size of your patient, because you certainly would not use the same amount of force in a hummingbird versus an eagle, right? You're going to crush one patient and do nothing for the other if you're using the same amount of force. Let's use that tortoise example. What do you do about the shell? You're not going to compress through it. So your best ability to compress the heart and the lungs is going to be to coordinate movement of the limbs. The front limbs and the hind limbs are going to move out of the shell and then into the shell, out of the shell and then into the shell, all four limbs at the same time. What does this do? You're creating kind of like a bellows, in order to increase pressure inside of that coelom, which is the reptile equivalent to the combined thoracic and abdominal cavity. Point of that is that when pressure increases in the coelom and the limbs are pushed in, that you might pump some blood out of the heart and you are going to help expel breath out of the lungs. When you pull the legs out, the opposite happens and you've created space for the heart to, again, refill and the lungs to refill with air. Fish. What do you do about a fish? They breathe by having oxygen in water flow through their mouth and over their gills. So you need to simulate that. If you don't have any apparatus to do that for you, then you can do it by swimming your patient. Swimming your patient. Put your fish in your hand and swim your patient back and forth. That will move water, as long as their mouth is open, through their mouth and over their gills in order to provide oxygen. As far as compressing the heart goes, in small fish, you would be able to do that as you swim them. In big fish, that is probably going to be challenging and possibly impossible.